Hello and good morning friends, welcome to the CEC-UGC live lecture. Dear friends, as you know that in our previous sessions, in our previous lectures, we talked about children with special need, and I would say that this is a series. We would be conducting numerous sessions under this series. So far we have conducted 2 lectures, and today also we are going to talk on children with special need. Today specifically we are going to talk on hearing impairment, how hearing impairment is caused, but still what could be done so that we could help out children who are suffering from hearing loss. So dear friends, I would like to tell you all that we have again with us in our studios Dr. Nilima Asthana. Dr. Asthana is assistant professor in Department of Education, Lady Irwin College, University of Delhi. So first of all, I would like to welcome our guest, Dr. Nilima Asthana. Dr. Asthana, welcome to the EduSet lecture.
So I am going to start again the same topic, but there are so many issues, so we cannot wind up the topic in a day. In my previous topics, I discussed with you the various policies and programs and history about special education, and as you came to know about the various categories of disability as given by Person with Disability Act 1992 and again revised. So today in that category hearing impairment is a very important category, and I am going to discuss what are the educational needs, what are the causes of hearing impairment, what are the technology which could be assisted in could be assisted the hearing impaired individuals, and how could we manage the classes for hearing impaired children. So today I just start with a brief introduction of the national policy for person with disability that was implemented in 2006. In that policy, the Constitution of India ensures equality, freedom, justice and dignity of all individuals and implicitly mandates an inclusive society for all, including persons with disability. And when we talk about inclusive society, it is a responsibility, you can say, of all of us, that we must include each and every individual in our society. We should not discriminate against any one of them, whether economical, physical, social or any kind of inequality is there. So unless until we are able to make an inclusive society, we will not be able to make a good India. So according to the census 2001, there are 2.19 crore persons with disabilities, and that was for the first time specifically disabled person were counted in the census. And in India, they constitute around 2.13% of total population, and you can say a very large percentage of population in India is disabled, and I am using the term disabled, which is not very which is not sounding very good, but to sensitize the population, the other citizens of India, it is important to make them understand that the population which is 2.13% disabled, we must do something to include that population in the mainstream society. This includes persons with visual, hearing, speech, locomotor and mental disabilities, as well as other disabilities also. 75% of persons with disabilities live in rural area, and you can very well imagine when we are not able to make a conducive environment in urban area, what is happening to those people who are staying in rural area, and that is 75%. Now again the 49% of disabled population is illiterate, and only 34% are employed, and it is really a very not a very good you can say scenario if we talk about the 67 or more years after independence. The earlier emphasis on medical rehabilitation has now been replaced by an emphasis on social rehabilitation, and social rehabilitation is very important to make an equal and just society. There has been an increasing recognition of abilities of persons with disabilities and emphasis on mainstreaming them in the society based on their capabilities. The Government of India has enacted 3 legislations for persons with disabilities. and there are several national institutes which are working in this field. So, in addition to the legal framework, extensive infrastructure has been developed. The following 7 national institutes are working for development of manpower in different areas, namely Institutes for the Physically Handicapped, that is based in New Delhi, National Institute of Visually Handicapped of Dehradun, National Institute for Orthopedically Handicapped, Kolkata, National Institute for Mentally Handicapped in Secunderabad, National Institute for Hearing Handicapped in Mumbai, National Institute of Rehabilitation Training and Research, that is in Cuttack, and National Institute for Empowerment of Persons with Multiple Disabilities, and that is located in Chennai. Apart from them, those institutes, there are several national institutions under the Ministry of Health and Family Welfare working in the field of rehabilitation. It is important for all of us to know and understand the working of these institutions, and these institutions are National Institute of Mental Health and Neuroscience, NIMHANS in Bangalore, All India Institute of Physical Medicine and Rehabilitation, Mumbai, All India Institute of Speech and Hearing, Mysore, Central Institute of Psychiatry, Ranchi, etc. In addition, certain state government institutions also provide rehabilitation services. Besides, 250 private institutions conduct training courses for rehabilitation professionals. And a very important initiative of National Handicap and Finance Development Corporation, NHFDC, it has been providing loans on concessional terms for undertaking self-employment ventures by the persons with disabilities through state channelizing agencies. And focus of the policy is on the valuable human resource for the country and seeks to create an environment that provides them equal opportunity, protection of their rights and full participation in the society. The focus of the policy is on the following. It is in the sequence of importance: prevention of disability, rehabilitation measures, women and disability, children with disability, barrier free environment, issue of disability certificate, social security, promotion of non-governmental organizations, collection of regular information on persons with disability, research, sports, recreation and cultural life, and amendments to existing acts dealing with the persons with disability. So, actually after so long it has been decided that there should be a comprehensive policy which should address various areas or various issues of disability, and it is not only prevention and protection, it is to make them totally independent as well as make them give them a good social and cultural life. So, there are so many changes brought in this policy from the previous policies, and try to make it more comprehensive and good, so that persons with disability should live a normal life in a society, and that society should be an inclusive society. Rehabilitation measures are now have a wider focus, and it has been classified into 3 distinct groups. It is first is physical rehabilitation, which includes early detection and intervention, counseling and medical interventions, and provision of aids and appliances. It will also include the development of rehabilitation professionals. Rehabilitation professionals include special educators, therapists, and so many other specialists of this field. And previously more of attention was given on physical rehabilitation, but the scope was narrow. Now the scope is quite big, and as we all understand that any rehabilitation work will work only when it is started at the very early stage. So, detection is very important. if a child is having any kind of disability, there should be provision to detect that kind of disability well in advance at a very beginning stage, so that right kind of rehabilitation program could be formulated for that particular individual. Then next is educational rehabilitation. It includes vocational education as well as professional education, as well as academic other kind of courses for them as per their capability and potential to make them independent. And third is economic rehabilitation for a dignified life in a society. Economic rehabilitation includes providing them employment opportunities, giving them loans, making them self-reliant through skill training, etc., and in a way to make them economically independent or financially independent. For disability, to address it more rigorously, it is important to educate those persons who are having disability. And as we came to know about the various categories of disability as given in the PWD Act, it is important to understand which kind of educational need is there and how to address those educational needs. So, education will be most effective when it is provided in the right manner. Right manner means that we should understand the type of disability, and accordingly we should plan the program to educate the child. It is most effective vehicle also for social and economic empowerment. Census 2001 says that 51% persons with disabilities are illiterate. So, half of the population is illiterate. There is a need for mainstreaming of the persons with disabilities in the general education system through inclusive education system. And for this Sarv Shiksha Abhiyan was started, which stated clearly that it will promote inclusive education. Now, as Right to Education Act is including also SSA, and it has a very good component covering the persons with disability and education for those children who are having some kind of disability. As Right to Education Act says that no child should be left behind, and it is the duty of the state and citizens of the state to include each and every child having disability into the education system. So, the legal binding is there, and it is the responsibility of each one of us to look for those children and make them aware that and as well as their families, that they should start the education of the children having some kind of special needs. Then children with disabilities in the age group of 15 to 18 years are provided free education under Integrated Education for Disabled Children scheme. So, how to do it? It is a major question, and for this I would like to show you a small video to make you understand that it is not a we should not take it as a charity. It is our approach to disability, and how should we address it. So, in this video which I have taken from the YouTube, it was tried to show you that we should not maintain the same notion that it is charity and it is help and it is assistance to make them independent. It is not that, it is the individual, the student with special needs, they need right kind of assistive technology to become independent, to learn better. And as the video was taken from YouTube and an Australian has developed this, that but this is not the story of Australia only, it is the global issue, and globally we say that we should support the individual through education, through economic rehabilitation, to make them a useful member of the society. So, today I am going to discuss specifically the hearing impairment with you, and how the child should be made to cope up with this kind of impairment. First of all, it is important to understand what is hearing impairment and what are the different kinds of hearing impairment, and it starts with ear. Ear is a very important sense of an individual, and we learn through listening. So, let us start with the structure of ear. The human ear consists of three sections: the outer ear, the middle ear and the inner ear. The outer ear includes the auricle or pinna, the visible part of the ear that is attached to the side of the head, and the waxy dirt trapping auditory canal, which is visible from outside. Then the tympanic membrane, which is not visible, known as eardrum. It separates the external ear from the middle ear. An air filled cavity. Bridging this cavity are three small bones, and they have their very specific role. These are the malleus, a kind of a hammer kind of bone, the incus, the anvil kind of bone, and the stapes, the stirrup. The innermost part of the ear is cochlea and semicircular canals, which are connected to the brain. So, you can see the picture, clearly it shows the outer external ear, auditory canal, then middle ear has been focused, and it is tried to show all the three bones, malleus, stapes and incus, and tympanic membrane is separating external ear from the middle ear, and then the internal ear, which includes cochlea and semicircular canals. So, you can say in any part of out of these three, hearing impairment can occur. Again, the picture shows the bones and internal ear. So, three parts of hearing mechanisms are all the three parts of ear: outer ear, middle ear and inner ear. As you know, the outer ear includes pinna and auditory canal, middle ear includes eardrum, ischian tube and ossicles, and inner ear includes cochlea, membrane and hair cells and auditory nerves, which are connected through brain. So, mechanism of hearing, as we come to know about that all the three parts are equally working towards this. So, middle ear contains tube which equalizes the pressure on two sides of the eardrum, that is external ear and middle part of the ear. Sound waves cause eardrum to vibrate. Subsequently, malleus and incus move and force stapes to oscillate. These are the three bones which are oscillated when some kind of sound waves are entered into the ear. Then eardrum converts pressure vibrations to mechanical vibrations. Mechanical vibrations are transmitted to the fluid contained in the compartments of the inner ear. And as the inner ear includes cochlea, which is a hollow spiral shaped bone, it contains the organs of hearing. You can see so many tiny hair-like structure and which play a very important part in the mechanism of hearing. So, mechanical vibrations are transmitted to basilar membrane of the cochlea. Basilar membrane supports the hair cells which respond to different frequency of sounds, high and low frequency. Each hair cell has about 100 tiny rigid spines or cilia at its top. When these hair cells move, they displace the fluid that surrounds them and produces electrochemical signals which are sent to brain through nerve cells along the auditory nerves. So, the cochlea plays a very major role in transmitting the sound waves to brain while converting them into electrochemical signals. These signals travel to a receiver placed beneath the skin and from there to electrodes that have been, this is regarding cochlear transplant which I discuss later on. So, types of hearing impairment, there are 5 types of hearing impairment: conductive, sensory neural, mixed, functional and central auditory disorder. The first one is conductive hearing loss, and it is the problem of the the problem arises with the external ear, and it is due to blockage or damage with the structure of outer or middle ear. Generally a blockage in the mechanical conduction of sound. Leading cause is middle ear infection, it is known as otitis media, and it results from the malfunction of the Ischian tube. Another cause is blockage of auditory canal due to excessive earwax or foreign body, and osteosclerosis is another cause. Osteosclerosis is the spongy bony growth around the stapes, the bone which is there in the middle ear, which progressively impedes its movement. So, a kind of spongy bone growth takes place around the stapes and it impedes the movement of the sound waves. Otitis media, as we discussed earlier, it results from malfunction of Ischian tube, and it causes the imbalance of air pressure on both the sides of eardrum. Oxygen in the air trapped in the middle ear is gradually absorbed by the middle ear cavity tissues, and it causes partial vacuum in the middle ear. When there is vacuum, there will be no sound wave. So, eardrum is pulled in the middle ear cavity. Tissues of the middle ear secrete fluids to fill the vacuum. This fluid may get infected, and if not checked, the fluid rupture the eardrum. So, this is the otitis media, which is the malfunction of Ischian tube, and it in turns create imbalance between the external ear and the outer ear, the imbalance of air pressure, and it may infect the tube and may cause the rupture of eardrum. So, conductive hearing loss is usually temporary. Amount of hearing loss varies depending upon medical condition that causes it. Seldom enough to make one deaf, can cause a child to miss sounds and words. Delay development of speech and language is another outcome of this hearing loss, and most but not all could be treated successfully with medicine and surgery. So, we can say it is usually a temporary kind of hearing loss which could be solved or treated through medicine and surgery. Then sensory neural hearing loss, it is due to the damage to the cochlea or optic nerve. Sensory neural means when there is some kind of sense and neurons and nerves are involved. So, it is due to the damage of cochlea or optic nerve. Damage is caused by illness or disease. A very viral disease, especially in children, may cause sensory neural hearing loss if it is prolonged and high fever. Rubella during pregnancy, in first 3 months if a pregnant lady is suffered from rubella, then it may cause sensory neural hearing loss to the child. Then infectious meningitis, mumps, measles, chickenpox and influenza, Rh incompatibility, erythroblastosis fetalis. Then ototoxic medication also causes sensory neural hearing loss. Ototoxic medicines which destroys hair cells in cochlea. Then hereditary factors are always there, and these are often present with multiple disability. If the child is having multiple disability, then also will affect the hearing ability of the child. Ototoxic medication are those medicines that destroys hair cells in cochlea, and these are cancimycin, neomycin, gentamicin, streptomycin and vancomycin, and a medical specialist can also give the list of the medicines which may cause hearing disorder. Then exposure to high intensity noise and aging are also the factors of hearing loss. Conductive and sensory neural hearing loss has been shown in this figure. So, in this case outer ear, middle ear and inner ear all are affected, and conductive loss could be treated through medicine and surgery, and sensory neural loss requires a more advanced kind of treatment. Then next is mixed hearing loss, when both kind of losses are there, that is conductive and sensory neural. Child relies on better ear and always turns better ear towards the speaker and face problem in determining source of sound. You can very well identify a child if the child is not listening from one side and can listen from the another side. So, the child always tries to show the better ear towards the source of sound and turns his or her better ear towards the source of sound, and child may face problem in determining the source of sound. Functional hearing loss is not organic in origin. It is generally affected to gain attention, explain a poor performance, avoid a responsibility or collect insurance money, and it may cause by mental illness such as stress and worry. Amongst children it occurs between 9 to 13 years, and you can very well understand that this particular age period of child's life, they are in the schools and there is a lot more pressure of the study in school. So, they may pretend they are not listening well and they are doing not good in studies. Then central auditory disorder, when there is no measurable peripheral hearing loss, show problem with auditory comprehension and discrimination, auditory learning and language development. Result of lesions or damage to central nervous system, have trouble in learning, often considered learning disabled because they may not show very clearly auditory disorder. So, they are taken as learning disabled. We try to analyze the hearing impairment through the degree of hearing loss, and a kind of category is given by Owens, Metz and Haas in 2003. They considered mild hearing loss that comes between 21 to 40 decibel, moderate hearing loss 41 to 55 decibel, moderately severe hearing loss 56 to 70 decibel, and severe hearing loss between 71 to 90 decibel. Profound hearing loss 91 decibel and above. Considered deaf. Assistive listening devices alone enable the individual to understand information presented orally. Age of onset is we can classify it prelingually deaf and postlingually deaf. Prelingually deaf become deaf before they learn to speak and understand language. 95% of all deaf are prelingually deaf. 1 in 10 have at least one deaf parent. Instead of oral communication, many learn through a combination of sign language and oral language. So, prelingually deaf, when the child is deaf before the understanding of language, before going to school, and if we considered a deaf population, 95% of all deaf are prelingually deaf, and they understand a combination of sign language and oral language. Postlingually deaf are those individuals who lost their ability to hear after developing language, having acquired or adventitious deafness. It may cause due to any accident or disease or high intensity sound, etc. So, there is a major difference between prelingually deaf and postlingually deaf, and their educational setting will also require a different kind of understanding. As I talked in the previously decibels, so assessment is done on the basis of the quality of sound, and two qualities of sound are measured in assessment process. First is frequency of sound and unit is hertz, and intensity of sound and unit is decibels. There are two qualities of sound, frequency and intensity. Normal ear hears sounds that range from 20 hertz to 20,000 hertz, and if it is beyond that, that sound frequency is beyond that, then we can say the child is having some kind of difficulty in hearing. A decibel level of 125 or greater is painful to normal ear. So, decibel level 0 to 120 are used to test how well an individual can hear different sounds. Academic achievement is another criteria. Reading skill is important, though it is a challenge for many students. So, to be able to get profit from captions on televisions and films, academic achievement should be that much, so that the child or individual should be able to understand the captions written on the screen. To communicate through internet and email and to obtain higher paying jobs. How to make them speech able? Intelligibility of speech is related to number of factors. First is degree of hearing loss, age of the individual, degree of hearing loss. It depends. If it is high degree, then it is quite difficult to make the individual able to speak very well. Then age of the individual. So, it is recommended that intervention should be started at a very early stage. Then communication mode used by the family. If family is only speaking and the child is not able to listen, then it is very tough for the child to understand the language. So, it is important to adopt a mixed kind of communication mode, for example, sign language as well as oral, as well as through different kind of assistive technology. Then presence of another disability. If hearing disability is there along with other disabilities also, then it becomes bit tough to make the child speak. Then listener's experience. The most important for me is listener's experience. If the child or an individual is getting very warm and motivational environment at home and school, he or she will understand and speak definitely. So, listener's experience plays a very important role to develop speech ability. Students who are hard of hearing usually have conductive hearing loss, more easily helped with hearing aid. Unfortunately, these students are easily overlooked, because if the child is having conductive loss, the child looks normal in the class, and the teacher does not understand that the child is not listening, and the child goes unnoticed, overlooked, and so many times the child does not understand the concept and teacher moves on. So, it becomes a very painful and pathetic situation for that particular individual who is in the class, of normal children and not getting any assistance from anyone. So, it is the major responsibility of the teacher and parents to understand what is the issues with the child and try to find out the reason and make the arrangement to let the child learn. So, these students should be supported with many visuals, and special seating arrangements are required for such children. Early intervention plays very important role, and it should start before the age of 6 months. It pays off better and it promotes reading achievement and speech ability. Preschool programs allow students to develop language at the right development periods of their lives, and we should start at the right age the preschooling of the child, and it helps families better understand and meet the very special needs of their family members. And a very interesting fact is there, and it is for you to analyze and identify this fact. There is a difference in the development of speech between deaf children of deaf parents and deaf children of normal parents. It is a puzzle, and you must find out the reason behind this, which child is better, will be better if the child's parents are deaf or the child's parents are normal parents. Important messages to understand the needs of these children. Early identification and intervention make a difference. Infants who receive amplification and early intervention by the time they are 6 months old significantly ahead at first grade. Early identified babies are 1 to 2 years ahead of their later identified peers with hearing loss, and early intervention makes the greatest difference in language, cognition and social skills. Now, teaching students with hearing loss. Educational program must include the services of audiologists, speech and language pathologists, interpreters, teachers of the deaf, and for those with multiple disabilities, occupational therapists and physiotherapists. So, actually what is lacking in our country is a kind of coordinated efforts which is required to educate the children having some kind of disability. For any disability we require a whole team to look after the child, and educational program is not cannot be strengthened by a teacher. We need the doctors, the specialists, the pathologists, the audiologist, the physiotherapist and everyone to make the child successful in his or her life. Other placement options should also be available, like general education classroom, resource rooms, special classes, special day schools and residential special schools. Because if we talk about inclusive education, it is always recommended that the child should be mainstreamed as soon as possible, and we always try to provide least restricted environment to the child. So, if a child in a normal class facing restriction in learning, so the child will not gain anything in that particular child. It means the child require some kind of special assistance to learn better. So, there should be a whole range of programs should be there for them. If they are gaining normalcy, they can be mainstreamed in the general education classrooms, and if they require some kind of specified learning resources, they should be there should be good resource rooms for hearing impaired children. The special classes are taken by specialists of that particular area. So, special educators are required, and special educators in hearing impairment are required. Then if the child is having very serious problem, then special day schools are required, and for extreme cases residential special schools are required when the child requires the special assistance throughout the day in a very sensitive environment. And there are certain common sense which we all can follow. And what are those plain common senses? Of course, these are validated practices, but known as just plain common sense. So, first of all, we should have simple, inexpensive, down to earth teaching methods. There is nothing very much special which should be adopted as a teaching method to teach the child. It should be very much simple, inexpensive, down to earth teaching method. You are not expected to familiar with every possible modification or accommodation. Rely on teacher of a deaf or hard of hearing and or an interpreter. There are certain specific tips for classroom management. We need to make adjustment for ease of hearing and seeing speakers, and if we give good attention to the child who is hearing impaired in a classroom of normal students, there are certain very simple tips which will be helpful for that particular child in a normal classroom. So, first of all is place the student as close to speaker as possible, because the child learns a lot through the lip movement of the teacher also. Instead of blackboard, use overhead projector or LCD, because the child is able to relate better with the bold letters and colorful pictures and colorful letters, which could be only possible through OHP or LCD projectors. And be sure there is no glare obstructing the projection. Reduce background noise as much as possible, because these background noise always create distractions. Do not stand with direct light behind you, because your lip movement will not be visible to the child. Why just plain common sense instructional practices are beneficial? Because deaf or hard of hearing students often need help to learn in general classroom. They are only partially or severely hearing impaired, but their brain is working as a normal child. So, they need help to learn in general classroom. Most of these are not having multiple disability. So, there is no physical other disability, and profit greatly from the general education experience with proper simple modification are made, which were discussed in the previous slide. Then implementing classroom practices for listening. We can have a rug in the classroom, bottom of the chair legs must have balls, just to minimize the sound, the noise of screeching of chairs or table or walking. Make sure heating, cooling system and lights are in good working condition, because it creates a good and conducive environment, as well as it should not be noisy. The noise from the air conditioner or fan or tube light may create hindrance in listening for them. Then decrease sound vibration with curtains or blinds on the window. So, we can make a room soundproof by putting curtains or blinds. Seat them where they can see everyone who may be speaking. So, they should be able to see each and every one. A teacher should be clearly visible to them. All their colleagues should be clearly visible to them, because when they are having a discussion, they understand so much through the lip movement. Seat students away from air conditioners, pencil sharpeners, computer centers and any other area with high noise level. Do not seat students with hearing losses in a special area away from the peers, and it is a very bad idea to make them sit at a segregated place. So, it should be totally avoided in a classroom. So, you should be visible while you are speaking, be alert to any classroom noise and try to reduce it. Use visual displays in your teaching, just not only write on the blackboard, use visual displays. Give specific directions and be sure to ask your students to clarify what you have said. Without asking them, without getting response from them, a teacher should not move further. Define key vocabulary words slowly and carefully. Use manipulatives to explain maths concepts. Manipulatives means aids and activities. Show multimedia presentation with subtitles. Have students share their notes. Use maps, globes and charts to demonstrate key concepts. Provide students with ample opportunities for discussion. Teach and practice using elaboration. For example, provide analogies, paraphrase material, identify main idea, summarize key points, etc. You must be very patient and slow while teaching in the class in an inclusive setup. So, be aware of your pace and slow down if students appear to be confused. Keep your hands away from your face while speaking. Always face students who are deaf or hard of hearing while speaking, and keep the use of figurative language to a minimum. Then access to the general education curriculum, deafness and LRE is least restrictive environment. Deaf community often advocates strongly for residential schools as placement option. Deafness in children is low incidence disability. Some teachers and many parents feel that a separate program best meets the needs of deaf students and is also the least restrictive option. For some cases you can say it is okay, but it is always recommended to have an inclusive setup. We should make arrangements for inclusive setup. We can have separate resource room for these children, but they can be allowed to sit in the normal classroom by providing them assistive technology. For classroom discussion, make certain the student knows who is about to speak and ensure that he or she is able to see each individual. For class discussion, arrange students' chairs in a circle so that student can see everyone's face. Overcoming challenges through the technology, and it is very important, which I tried to show you in the video also. Assistive technology could be grouped into 4 categories: assistive listening devices, telecommunication devices, computerized speech to text translations, and all alerting devices. These help people listening by increasing the amplification of sound in the environment, including other speech. 3 general types of assistive learning devices, listening devices are available. These are hearing aids, cochlear implants and FM transmission system, frequency modulated transmission systems. Hearing aids are those assistive devices which amplify sound but not surgically implanted. These devices have eliminated the need for special education for many children who are hard of hearing. And there are certain kinds of hearing aids available behind the ear, in the canal and completely in the canal. So, these aids are could be implanted mechanically daily or occasionally. These days many hearing aids are digital also. You can see the picture. There are 3 different kinds of hearing aids: behind the ear, and in the canal, and very much into in the canal. These are the different types of hearing aids. You can see digital hearing aid and very interesting hearing aid with earrings. So, it serves both the purpose. I will start with cochlear implant. As I discussed earlier, cochlear implant is a device that turns sound waves into electrical signals, can help many people with severe hearing loss regain hearing. A microphone picks up the sound waves and transmits them to a speech processor, a miniature computer that turns sounds into digitized electrical signals. You can see the pictures of cochlear implant. This is not hearing aid. You can see the microphone as well as the digital this thing. So, it includes transmitter, speech processor, microphone and battery. I have tried to show you in these two pictures speech cochlear implant with the speech processor, microphone, etc. It is a bit clear. You can see the microphone, implanted receiver and a long tube which is going to cochlea, and cochlea in turn conveys the message to the brain. And frequency modulated transmission device are the digital devices which overcome the distance and background noise. New versions use small devices and provide freedom of movement for both teachers and students. For large rooms, another solution is the audio loop routes sound from its source directly to the listener's ear through a specially equipped hearing aid or earphone. Middle ear implant, if hearing is not effective enough, we need a middle ear implant which used to be surgically implanted, and these provide about 85% of improvement in hearing. These are the middle ear implant. Then telecommunication devices, you would have observed on TV the captions, and those captions are very useful for individual who are having hearing difficulty. So, provide oral information in alternative formats, captions for TV or movies. And again, text telephone device that allows people to make and receive telephone calls by typing information instead of speaking, previously called as telecommunication device for the deaf. Major drawback is to have a unit on both the ends. Voice carryover, a text telephone allowing both voice and text. These days mobile phones are very much disabled friendly and they can carry so many features. Then personal data assistants, devices that allow the user to send the text messages, use email, access the web via wireless telephone system, and these can vibrate with each incoming communication, allows immediate typed responses. Then speech to text translations, these are real time captioning. Components are laptop computer, specially developed word abbreviation software program, and a computer visual display. So, for that trained C-print captionist is required, listens to the lecture, types codes that represent words into computer. Transcription is instantly shown on a monitor or individual's laptop, and it improves social interaction also. Then automatic speech recognition is also there. That technology converts speech into text almost instantaneously. Then alerting devices are also there, and these devices attached to a lamp that flashes on and off for a signal, and these are very helpful for deaf people to make them aware of events in their environment through a loud noise or sense of sight or touch. And these are a few alerting devices. There are so many. One is in necklace, one is in bracelet, and there are so many. So, I would like to finish my lecture here. Thanks
with this note, thank you ma'am, thank you so very much for giving us a productive session. And as we said that this is a series and under the series we are going to conduct more and more lectures on children with special need. I hope that you must have liked this lecture, and if you have any feedback regarding this particular lecture, then you can mail us at info.cc@nic.in. We would be meeting again very soon and would be taking up another topics under the series. Till then, take care. Goodbye. Thank you, ma'am. Thank you so very much.
Thanks a lot.